My name is Molly O'Brien with the Association of Migraine Disorders, and we really appreciate you being with us today. This is a live session in collaboration with and sponsored by NeuroHealth. I'm Molly O'Brien, and I just want to give you a quick intro about NeuroHealth. NeuroHealth is a virtual neurology clinic that can connect you with top neurologists and physicians' assistants. NeuroHealth provides unparalleled proactive care for headache and migraine, sleep disorders, neurological pain, epilepsy, concussion, and more. NeuroHealth is staffed by top board-certified neurologists and subspecialists. NeuroHealth connects patients with a neurologist via a video visit within just a week. Patients received a personalized treatment plan and dedicated health coach and concierge team to manage their neurologic disease. NeuroHealth's quality care improves the quality of life for people with neurological illnesses. And if you are interested in trying NeuroHealth, you can receive $15 off your first month of membership. All you have to do is use the discount code AMD15. AMD like Association Migraine Disorders, and 15 for that $15 off. All right, let's jump in here. Today we're talking about headache and time change. So with daylight saving time coming up, we wanted to know, can time change, be it just an hour or more than an hour, really give people a headache? And is that a fair statement even? Can people without migraine Can people without migraine disease feel the impacts of time change? People with cluster, and we want to know why. To answer some of these questions, we are happy to have Dr. Jennifer Chima with NeuroHealth. So let me give a quick bio and then we'll dive in here. So Dr. Jennifer Chima is a neurologist with fellowship training in headache medicine, and she completed her neurology residency and headache fellowship at the Cleveland Clinic in Cleveland, Ohio. Having suffered from migraine with aura since she was a teenager, Dr. Chima understands firsthand how debilitating it can be to live with migraine and manage. As a neurologist, she works with her patients to help them make informed decisions and to develop individualized treatment plans based on their personal goals. And in her spare time, she enjoys hiking, practicing yoga, and traveling. Dr. Chima, thank you for being with us today and providing your expertise, and thanks for dealing with some of the technical hangups we've had earlier.
Yeah, thanks for having me.
Very excited to have you here today. As many of you from home might notice, I'm glancing down at my notes here just to make sure that we cover everything. So forgive me if I'm turning my attention this way. Before we dive into our conversation, I just want to give a quick disclaimer for our audience. This content is not nor intended to be a substitute for personal medical care. You should always talk to your healthcare provider before changing or stopping any treatment plan. And for those of you watching, feel free to drop us some questions in the chat and we'll do our best to answer them. And please just be reminded that we cannot answer personal medical questions. Okay, so we'll start off very basic, but also very broad question. Can time change give people a headache? And if so, why is that?
Yeah, so it absolutely can, as you can guess by the fact we're doing this Instagram Live right now. So the main reason that time change can cause a headache, and whether that's daylight savings time or, like you had mentioned, more hours, something like travel or jet lag, all of these things can disrupt a person's circadian rhythm. The circadian rhythm is essentially the body's internal clock or their natural rhythm that helps them maintain a 24-hour sleep-wake cycle. And then anytime there's a time change, it gets disrupted, and that can trigger headaches.
So that really helps give us just a basic understanding of our conversation today. It sounds like because this time change affects our circadian rhythm, disrupts our sleep, is that kind of the main cause, or are there other factors at play here? What's actually happening within our body when we go through this time change and that seems to give us a headache?
Mm-hmm. Yeah, so certainly sleep is a big factor, but it's definitely not the only factor. In terms of what's going on with our body, a lot of it actually has to do with sunlight exposure, or in this case, lack of sunlight exposure. So, sunlight both stimulates the hypothalamus to promote wakefulness. And real quick, the hypothalamus is like the part of the brain that controls the balance or homeostasis of your body, those sleep wake cycles. So, sunlight helps promote wakefulness, and it also inhibits the production of melatonin. Losing that, it just throws your whole sleep wake cycle off. But it's not just the sleep that's affected, right? So if you're shifting when you wake up, you're shifting when you eat breakfast, when you drink coffee. If the hours, the daylight's less, maybe you're not going outside, you're not as physically active. There's just a lot of different components that all work together to make you miserable.
That's so interesting. I've been looking into this obviously for some time and living with migraine my whole life, but I never quite connected. Yeah, if I'm waking up an hour earlier, I'm eating breakfast at a different time. Just all these little different things that are disruptive to our schedule, and migraine brain really likes consistency. So all those little changes, that makes sense that it adds up. Let's talk a little bit about how daylight saving time can be a trigger for people with cluster headache. What is the connection between time change and cluster headaches?
So cluster headaches are really interesting. We don't know exactly what causes them, but we believe that it's related to dysregulation or dysfunction of the hypothalamus, which again is that part of your brain that controls your homeostasis and your sleep-wake cycles. This dysregulation is actually why we think headaches come in clusters. Often they come at season shifts, or they always come the same time of year, or same time of day when they're in a cycle. Often people wake up at 3 a.m. every day with a cluster headache during a cycle, and that's related to that circadian rhythm and the dysfunction of the hypothalamus. So you're getting people who are already vulnerable in the season shift, and then just throwing this abrupt time change at them, and just that 1-2 punch is enough to throw people into a cluster cycle.
So staying with cluster, is it recommended, and obviously you can't give personal medical advice, but in general, is it possibly recommended that people with cluster take any type of preventative medication that they have before the time change or leading up to a time change? Could that be helpful?
So it could be helpful, and it's a good question. Everyone's different, obviously, so something to discuss with their neurologist. But if you're someone who really consistently every year notice you get cluster headaches around this time, it doesn't even have to be a time change. I mean, if you're someone who says, this is every summer I get a cluster cycle, if you can predict that, then we can use that knowledge to say, okay, well, maybe if we start a preventive a week or two early, we can get ahead of it and hopefully prevent a cycle, or at least decrease the severity and duration of it. So it's a very good question, something definitely worth bringing up because it can be helpful.
Okay, we appreciate that's a great answer. And originally we had mentioned what's the relationship between cluster headache and time change. Let's take that same framework and talk about migraine, whether it's the same or whether it's different. So people with migraine can also have difficulty with time change. Is there a relationship between migraine disorder and time change?
Yeah, so certainly some of the things that can trigger cluster can affect migraine too. So the change in sleep certainly can be a trigger. Migraines are a little more complex in that they have so many different triggers that are different for everybody. But as I had talked about a little bit earlier, there are so many different things that are going on around that time that can trigger migraines, whether it's the change in caffeine, or you're fasting different hours, eating different hours. Maybe you're just stressed because of the schedule change. You have kids, you have to wake up an hour earlier now. And also, you may have mood changes from the lack of sunlight, right? So mood has a big role with migraine, and this is the time of year when people get seasonal affective disorder, and that can also exacerbate or trigger migraines.
So fascinating to me how it's all so interconnected. People with migraine might have trouble because of the time change, but also mood can be impacted, like you said, because we're not having enough daylight. I say way too many times in the winter, it's dark already, it's only 4 o'clock. And it's a psychological thing sometimes, but also there's a lot more at play, which is really fascinating. All right, so all of that being said, we had mentioned that it's not just daylight saving time that can affect people because changing time zones can also be problematic. Say you're taking a long flight, changing multiple time zones, there's a lot of chance there that you could be impacted. So that being said, do you have any suggestions or ways that people can prepare for a time change, be that daylight saving time change that's coming up, or maybe someone's taking a trip and traveling outside of their regular time zone?
Yeah, so if you have a little bit of time to prepare beforehand, you can try to do a more gradual shift in your schedule so you're not hit all at once. So, for example, say you're going to say it's daylight savings time, so it's an hour. If you want to just take 4 days to do 15-minute shifts every day to get to that hour, or you want to do 6 days, 10-minute shifts in your routine every day, it can lead to a more gradual change. It's a little bit easier for your body to deal with. So what that might look like, for example, if you're going to do 15-minute shifts, if you normally wake up at 7, next day wake up at 6:45, drink your coffee right after that, eat around that time. Everything has that gradual shift. And then 6:30 the day after that, then 6:15, then 6. At least then it's not such an abrupt change and it gives your body a little more time to adjust.
That's really interesting and a really helpful strategy. Might not be feasible for people who have young children, or I guess going backwards is easier rather than like oversleeping, going the other way. So it makes more sense this way. Do you have any helpful ideas or strategies when it comes to kids? If children have migraine, it might be difficult to wake them up 15 minutes earlier from their normal routine or a half hour, but maybe that's a great way to start. Do you have any recommendations for children with migraine?
I personally have a 6-month-old, and so I understand that it's very hard
Congratulations.
to do what you need them to do. So certainly you can try the gradual change, and if that works, it's great. But don't stress out about it too much because that's just another thing to stress out about. As someone who's very sleep deprived, like I really get that. But yeah, so in terms of when daylight savings actually happens, there are some things you can do to help them adjust. Getting them outside during the day, playing outside, that physical activity and sunlight can help with the wakefulness component. Limiting screen time, keeping a consistent bedtime at night can help promote sleep. It can take kids longer to adjust than adults, so to the best of your ability, I know you're not going to be feeling good either. I'm not feeling good, but just try to be patient with them because it sometimes can be a little bit harder for kids. If they do take medications, if they take a preventive, make sure they're taking it consistently every day around this time especially. And if they take a rescue, just make sure they're on top of it, taking it right at the onset of their headache so it can last or it can be a little bit more effective if you do it that way.
That is great advice and congratulations. I hope you start getting more sleep soon. I feel like right around 5, 6 months, that's when it starts getting a little better sometimes. We'll hope for you. And I do feel like we could have a whole other discussion about kids and babies and toddlers and daylight saving time. All right, so we talked about some of those strategies for ways to prepare for a time change. We can do our best to help prepare. Then what do we do after the fact? So daylight saving time is Sunday. What do we do on Monday, Tuesday, Wednesday following up after? Is there anything that we can do to help ourselves after the time change happens, whether we prepared or not?
Yeah, and sometimes you just can't prepare and it sneaks up on you, and that's fine. You're still a good person. It might happen. Yeah, so basically it's all about trying to reset the wakefulness and the sleepiness at the right time, your new right time. So in terms of during the day, getting outside if there's sunlight. Now I'm from Cleveland initially, so I understand this time of year we call it the gray because you do not see the sun for 6 months out of the year. If that's the case, you can always try a light box, like one of those light therapy boxes that they use for seasonal affective disorder, just to get some kind of light exposure. It can at least mimic sunlight. Regular exercise, get those endorphins going if you can. And then in terms of night, the standard sleep hygiene things, try to avoid screens, try not to do very stimulating activities at night. You could even talk to your doctor about something like melatonin short term. Also, people are often vitamin D deficient this time of year. That's something you can talk about as well and see if a supplement would be helpful for you.
Okay, that's great to know. I don't know if this is outside of your scope, but I'm curious, can melatonin be helpful for people with migraine this time of year, but also other times of year? I know you just mentioned short term. It's not something you want to rely on every day, but can that be beneficial with that sleep-wake cycle?
It can. It's most helpful with something like a time shift. So those are the most effective times to use it, but it can be helpful. And interestingly, with cluster headache too, because there seems to be some sort of dysregulation with the melatonin production, there have been studies that show that melatonin supplementation might help with cluster headaches as well. That's
So interesting.
topic.
Okay, well, thank you for that. I know that was a little bit of a detour there. Folks, if you are interested in some type of supplements, that's a great question to talk to your healthcare provider about. We talked a little bit about kids as well, so I appreciate that. And now we have a couple questions from our followers that we gathered ahead of time. And this first question has to do with dizziness and sleep. What do you know about how sleep can affect dizziness? As one of our followers questioned, they have vestibular migraine. When they sleep more, they have more dizziness. But when they sleep less, they have less dizziness. Could it be related at all, I guess is the question.
Yeah, it could be. I mean, with anything with this homeostasis I'm talking about, too much of something or too little of something can throw things off. Now, for vestibular migraine or any other migraines, a couple of reasons that oversleeping might be a problem could simply be, well, you're not eating or drinking when you're sleeping. So more likely to have dehydration, could be related to fasting. Oversleeping may also throw off your serotonin balance, and serotonin has some activity in regulating vestibular neurons and with migraine, which is why we treat with things like SNRIs or even triptans, which modulate serotonin. Long answer to say, yes, it can be a factor.
Okay, great. No, that's really interesting. This follower asked, and we covered this, but let's touch base again because not everyone had joined at the same time. This person wants to know, why do people without any history of migraine or cluster, why can people without a headache disorder experience a headache during a time change?
The triggers for headaches, whether it's migraine or cluster or tension headaches, they're all very similar. They may present in different ways, they may manifest in different ways. Often people with migraine or cluster have a genetic disposition or some other underlying factor that leads them to get that specific type of headache. But even if you don't have that, a lack of sleep, change in eating habits, stress, all of these things can trigger a normal headache or a tension type headache.
Great to know. So those were some questions from the AMD side, and we have a couple questions while you're here, Dr. Chima, that aren't quite related to time change, but came from the NeuroHealth audience. So if you have just a couple more minutes, we can jump into these if you don't mind.
Yeah, that's fine.
Sounds good. Okay, great. This follower asked, what would motor weakness in the face and body on either side mean? Earlier this year, we had a conversation with NeuroHealth about mums and hemiplegic migraine. So we'll talk about this, and then we will direct some followers over to that podcast interview we did too, if you're interested in learning more. So the question being, what would motor weakness in the face and body on either side mean?
Mm-hmm. When speaking about migraine, weakness on one side is the type of migraine aura, essentially. And I know a lot of you know this, but just to briefly say, an aura is just basically a weird neurologic symptom that happens usually before your migraine, or it can happen during your migraine. The most common is something like visual, like flashing lights, colors in the vision, but there are other types too. Some people get numbness on one side, some people get dizziness or vestibular migraine. Weakness on one side is a type of migraine. Like you said, there's hemiplegic migraine, there's MUMS. It's a migraine phenomenon. Now, if it's related to your migraines, it should get better and you should go back to normal afterwards. Not necessarily something to be concerned about, especially if it happens frequently with your migraines. But if you've never been evaluated for it, please get evaluated for it, just because there are other things that can cause weakness on one side as well that may need to be ruled out.
Wonderful. Thank you for that. And another follower asked, how can I prepare for onabotulinum toxin A or Botox for migraines? Do you have any advice on how people can prepare for a treatment?
Yeah, so I'll start by saying there's nothing specific that you need to do. So if you walk in and you haven't thought about it at all and you're going in blind, that's fine, you'll be fine. I will say that often I think the anticipation is a lot worse than the actual injections. I think reading up on it, getting prepared just to know where you're going to be injected, what that's going to look like can be helpful emotionally and for anxiety. I will say I would strongly recommend you eat and drink before your appointment because some people can get lightheaded or get that vasovagal or feeling like they're going to pass out response. So just making sure you have something in your system, and definitely let us know or let the person doing it know if you're not feeling good or feeling faint. Otherwise, just things you can do to make our lives easier. If you don't wear makeup, if you don't have a weave, that's all helpful just to keep the skin clean. And we do need to inject in these areas, so your natural hair if you can.
And that being said, all great points. Is there anything that people can do after an appointment that could be helpful?
Yeah, for the most part, I say take it easy right afterwards. You don't want to put a lot of pressure on your face because you don't want the Botox to spread. That's when we worry about like cosmetic issues like a raised eyebrow or something like that. It might hurt. I think people should know your headaches can get worse afterwards temporarily as your body is adjusting to it. So you could take one of your rescue medications. I even have some people who take their rescue medications right before their appointment to try to fend off a headache or prevent a headache if they know they're going to get one every time.
Okay, that is excellent advice. We appreciate that. And I think that's wrapping up for the most part our questions on time change and other things relating to migraine, headache disorders, as well as cluster. Dr. Chima, do you have anything else that you want to share with followers that either could be helpful or a point? Any last words as we head into a big time change coming up?
I guess I would say do your best, but if you get a headache, it's not your fault. We all do our best, but some of these things are out of our control. Any advice I give is just to be a helpful tool, but if you get a headache, if you can't follow the schedule, you're not doing anything wrong. Just do your best. We'll all get through it.
Absolutely, I love that. And we'll all get through it, and then we'll go through it again in the spring together.
Yeah, and special shout out for everyone with babies. I'll be there with you.
Absolutely. Hopefully it goes well for you and all the other folks with babies as well. Yeah, it can be tough. We'll get through it together. I just want to say another big thank you to all of our followers out there and everyone who watched and participated today. This wraps up our Instagram live session of the Association of Migraine Disorders in collaboration with NeuroHealth. And if you have any more questions about migraine, you can, of course, visit our website, migrainedisorders.org. And I want to remind folks out there watching, if you're interested in trying NeuroHealth, you can receive $15 off your first month of membership. All you have to do is use the code AMD15. Dr. Chima, thank you again for helping out with all of this information today. It's been a pleasure speaking with you. Thank you for your time. And again, thanks for dealing with all of our technical difficulties earlier.
Yeah, again, thanks for having me. I really appreciate that.
Thank you. All right, everyone. I'm Molly O'Brien with the Association of Migraine Disorders. Appreciate you and good luck in any and all time changes that you have coming up. Take care, and we'll see you next time.